The tooth in eye surgery, also known as Osteo-Odonto-Keratoprosthesis, is a complex medical procedure designed to restore vision in patients who have suffered corneal blindness. The human eye is composed of several parts which aid in vision. The cornea is the transparent outer layer of the eye that takes in light, ensuring vision. When the cornea becomes damaged due to injuries, infections, or certain medical conditions, it loses its clarity and functionality. In these cases, the surface of the eye becomes too hostile for conventional methods of treatment. Doctors then employ an extraordinary solution known as the tooth in eye surgery. The surgery begins when a surgeon extracts a healthy tooth from the patient. The chosen tooth is usually a canine tooth because of its robust root structure and size. However, if a canine is not available, another tooth with a strong root may be used. The selected tooth is removed along with a small portion of the jawbone and surrounding tissue. The extracted tooth is carefully sculpted and a hole is created in the center to accommodate an artificial optical lens. The sculpted tooth, complete with the inserted artificial optical lens, is then implanted under the skin of the patient's cheek for about 2 to 4 months. This allows the tooth to fuse with the new tissue environment and develop a blood supply. During this time, the implant continues to stay alive. This further prevents rejection when the tooth is later transferred to the eye. While the tooth is resting in the cheek, the next phase of the surgery begins with the damaged eye. The damaged or the scarred tissue of the cornea is removed. The eye is prepared by surgically removing all the tissues that could interfere with the procedure, ensuring the eyeball is ready to receive the tooth structure. After the healing period, the prosthetic is taken out of the cheek and then finally transplanted into the eye. The prosthetic sits in the front of the eye, with the lens positioned precisely in the center to allow light to enter and reach the back of the eye, the retina. After implanting the prosthetic, the surgeon then removes a small portion of the buccal mucosa, the inner lining of the cheek, and places it over the eye. This skin will protect the implant and promote healing. The recovery process after the surgery can take several days. Initially, the patient's vision may be blurry as the eye heals and adjusts to the new prosthetic. However, over time, vision begins to improve, and finally, patients regain functional vision, usually good enough to recognize faces and objects, read large print, and move around independently.